I go through about 30 or 40 markers in my comprehensive panel. I'm not going to go through all the numbers, but I'm just giving you some of the main ones and giving you a test of how it's so important. But the good news is you don't have to learn how to interpret this. You got me to help you. So glucose is the storage form of carbohydrates. Our bodies need glucose, and it's stored in the body as glycogen to give you energy between meals and while you're sleeping. And so when you need it, the glycogen converts to glucose. But some of us are eating so much, the body never uses its stored form. Okay? Your body's like, wait, I got enough. So if you're not eating, you have storage and the body can utilize it for energy. It's like a savings account. If you keep putting money in spending and putting money in the checking account, you never use your savings account. Same thing with the body. If you keep putting glucose in there, you never tap it into the converted glucose. You're probably putting in too much glucose in your body. And then when the glycogen storage is full, it stores in the other areas of the body, which leads to the diseases. So it stores in the hips, the brain, the thighs, the heart. You get all this fat. A lot of times Alzheimer's is because of inflammation of the brain. They call Alzheimer's type 3 diabetes. So it's really understanding how it all comes together. Glucose is increased in insulin resistance, diabetes, and liver failure, because the liver plays a role in storage. And if there's too much going on, the body shuts down. So that's why I love fasting, because fasting gives you an opportunity to use your storage form and give your body a break, because your body's like, I got enough. Let me use what I got. So that's why intermittent fast, a lot of people ask me about that. And long-term fasting is important as well, but I wouldn't recommend doing it on your own, because you got to reduce the inflammation first and get your body to do what it's supposed to do. So I just want you to understand the process it takes. And that's why you can't use a 3-day fad diet and hope it works. This is stuff that took a lifetime to get you to where you are, and it's going to take time to repair it. Hemoglobin A1C is the measure of your blood glucose concentration. So glucose is very triggered by daily fluctuations, where the A1C is more of an average of 3 months. So your glucose can go up and down, even if you're diabetic, but the A1C usually maintains pretty much the same. It's like that concentration. It tells you how thick that blood is. It's telling me how syrupy it is. Because what happens is when A1C gets too high, your blood gets too thick and syrupy, and that puts a lot of stress on the heart. That's why people get high blood pressure. It's not because the heart is bad, it's because the blood is bad and the heart is having a hard time pumping maple syrup through your body. That's really what it is. Triglycerides, it's a lipid found in the blood, and increased triglycerides are associated with total cholesterol elevation. In other words, when people's triglycerides get too high, that is a source of fat in the liver. So we got to understand what these numbers mean. And this is what I help y'all do is one thing about the numbers, but understanding what they mean and what we need to do about it. Do we need to heal the liver? Do we need to heal the digestive system? Do we need to heal the gallbladder? Do we need to do some intermittent fasting? Do we need to reduce, there's so much that needs to be done. Because you can change your diet, you can go plant-based, which is the new fad right now. But if you're not fixing this, you're going to struggle, whether you're doing plant-based, keto, paleo, or whatever. I hate the term diet. Eat to live, eat to function, eat to metabolize, okay? AST is another one, and it rise in injury or death of all of the cells that are present in the heart, liver, skeletal muscles, kidney, brain, pancreas, spleen, and lungs. So the reason why I said they usually do this test, they'll just say it's liver enzymes, but they don't tell you it's also heart, liver, and all these other things that I mentioned. So when this number is really off the charts, then there's another test called isoenzymes where I can actually see where it's coming from. Is it coming from the brain? I think it's the bone as well. And when I saw this number high once, and then I did an additional test for somebody, she found out she had a rare bone cancer, which would have never been detected, but it was detected because she did a comprehensive panel and we got it we got it under control. But it was so rare, it probably would have been overlooked. So this is how powerful a comprehensive panel is, whether you think you need it or not. Healthy people should get their labs, because how do you know you're healthy? Again, you don't have to have symptoms. Just because you don't have symptoms doesn't mean you're healthy. You can have underlying conditions and have no idea that you have it. But when you look underneath the hood, so to speak, and look at your blood chemistry, you'll be surprised at what's out there or what you see. ALK-Phos, another enzyme. It originates in the liver, bone, and placenta. So a lot of diabetics have too high of ALK-Phos because with all the stuff going on, the bones start to damage in the process. So now when I see high ALK-Phos, it's saying, okay, there's bone damage now. But we're told osteoporosis. No, your bones are inflamed. So the bones, you're tearing your bones down. Bones are a cell. Your bones are inflamed. They're breaking down, dying prematurely. How do you fix that? Again, it goes back to cellular inflammation. All right. And it's normally elevated in teens. So you got to understand what the numbers mean. So sometimes it goes high normally in children and teens because their bones are multiplying and growing. By the time we hit our 20s and 30s, we're not growing anymore. So we don't need the increased bone growth. But it is naturally elevated in children and teens and in pregnant women because they are growing a newborn child. So it is, you got to know how to read it. Is it a normal high, or is it a sign of liver, bone, or, some other type of disease? So your cholesterol, I talked about this because I talked about statins, but it is found in animal oils and fats. So we do need some cholesterol. It is a component in the cell membrane, and it's a precursor to our hormones. So we talk about good cholesterol and bad cholesterol. There's no such thing. There's a job that HDL does, and there's a job that LDL does. One goes to the liver. I think the LDL goes away from the liver, and then the HDL goes to the liver. So it's like a packaging thing. The liver packages this stuff and say, okay, let me send it to the brain. The brain uses it, sends the empty package back to the liver. The liver fixes it up again and says, all right, go to the heart. The body is doing all that. All you got to do is give it the tools so it can work. But y'all are just stressing your bodies out, and it won't do what it's supposed to do. So there's no good and bad. It's just a balance. So when I see that with one is off and the other isn't, I'm looking at, okay, there's the liver is really trying to get rid of stuff and take it somewhere, or a lot of stuff is like putting the weight on the liver. So looking at the direction and comparing it to the other markers is what's important. So just know that cholesterol is your friend. We need cholesterol, and it is needed in every cell in the body. And when it does increase and you're told you have high cholesterol, it's because there's inflammation. And when you have high inflammation, it damages the walls of the arteries. So actually the body is trying to protect you by think of cholesterol as spackling. It's to protect you from the damage. But when you get rid of the damage, it will normalize and heal. So again, you're not being told that. You're just giving a medication which doesn't fix it. It might lower the cholesterol, but what that does is lower your protection and exposes you to inflammation. So I do go into HDL a little bit. So it plays a role in cholesterol and lipid transport from peripheral tissues to the liver, okay? So peripheral is the organs outside the body. So you got the cholesterol and lipid transport going to the liver. That's what HDL is. And then the LDL goes from the liver to the tissues. So both are important. So again, we've been told so much false information and we get confused, but here I am empowering you so that you stop making these mistakes that can be very harmful and dangerous to your health. There's a few more. Particles. These are never measured outside of functional medicine. And I'm learning that it's not the cholesterol that's putting people at risk of heart disease. It's actually the particles. Because I've seen people taking their heart meds and their cholesterol meds, and they still have high particles every single time. But it's looking at oxidation, it's looking at the free radicals, and it is a strong indicator for heart disease. Again, the heart disease is really in the blood. The particles are in the blood. It's actually the particles that carry the cholesterol. So, you got the particles and the cholesterol is actually inside. So it's those small ones that get in the cracks of the arteries. So these numbers are so important. And a lot of cardiologists know this. I learned this from a cardiologist, but he's not working in the hospitals. He has a private practice because, again, insurance isn't covered by this. Doctors are, if doctors step outside the norm and do stuff that's not in protocol, they get fired, they get dismissed. So that's why a lot of these doctors have their own practices, because they're not allowed to work in the hospitals. And then we got to look at ratios, how one relates to another, because they usually do the cholesterol and HDL ratio, but I like the triglycerides HDL ratio, because this is a more of an accurate predictor of insulin resistance and inflammation than the other markers are. So as you can see, there's a lot going on. I just want to let you know what needs to be known, and that you don't know what you don't know. So we need the knowledge and we need the information so we can take action, because a lot of us have been taking action on the wrong information. We need to start getting the right information and taking action on that.